Says something about American healthcare when people leave the country to pay for the care they need. Deloitte Consultants says 750,000 U.S. patients, 750,000 Americans, left the country in 2007 to have heart surgery or other types of medical care. By 2015, that number is expected to grow, according to Deloitte, to 13 million. That is opportunity for 2,000 insurers, clinicians, and travel agents who are gathering in Los Angeles on Monday for the World Medical Tourism and Global Health Congress. Renee-Marie Stephano is president of the Medical Tourism Association, which is hosting the conference. He joins us from Los Angeles. Renee, welcome to Bloomberg News.
Thank you for having me.
Renee, could you define for us medical tourism?
Very simply, it's patients traveling from one country to another for health care. The drivers, why they travel are different. Sometimes it's cost, sometimes it's access. For the most part, they're looking for better quality and more affordability.
And Renee, this isn't a new phenomenon, is it?
No, medical tourism has been going on for hundreds of years. Patients traveling from one country to another, typically for better quality. But now what we're seeing, the trend, particularly for American patients, is traveling to Latin America, Asia, and other parts of the world to get better affordability, better cost.
The other side of this, critics, as I'm sure you are well aware, are claiming that countries like India, for example, are spending too many resources on luring the medical tourist as opposed to helping the problems with healthcare in their own country. In many cases, impoverished regions are dealing with a crumbling healthcare system and don't have access to some of the top global quality healthcare that their country has to offer.
Yes, this can be part of the challenge with developing in third world countries the healthcare system. Basically, what needs to be avoided is creating a two-tiered system. But most of the hospitals are reinvesting in their local population and building hospitals and not creating the two-tiered system, creating affordability for their local patients as well.
What is your organization doing to prevent this two-tiered system?
Our association is based on transparency in terms of the quality and the pricing of health care. We encourage our members to reinvest in the local population, as well as to participate in educational programs to teach their local population to take advantage of some of the programs that they're building for international patients, such as pre-cancer screenings and preventative medicine that typically aren't used in many of these countries.
And we should point out, I guess you could call it reverse medical tourism, because this is not just a question of Americans going to other countries to get more affordable health care. We have heard stories, as I'm sure you have, of foreign dignitaries, say, coming to the Mayo Clinic in Rochester, Minnesota, to get health care here, but health care that may be, according to them, on a greater scale than they would receive in their own countries.
Well, this is true. Historically, people have traveled to the United States because of the reputation of the United States having the best modern technology. But what we're finding is a global improvement of the delivery of healthcare services. High technology, robotic surgeries, the same types of surgeries that you can find here in the U.S. Are being used throughout the world. So I think that the playing field has leveled quite a bit.
And Renee, I should point out, because I noticed something that you told Lori. You said people traveling for affordable health care. Does affordable health care necessarily translate into better health care, or is it just cheaper health care?
No, it's not in all cases. In many parts of the world, what you'll find is that the hospitals are internationally accredited hospitals. The surgeons are U.S. and European trained, many of them board certified, and in many cases, those surgeons have more experience in the procedures that are being sought by patients merely because of the fact that they have performed more of those procedures due to countries having high populations.
Renee, will healthcare reform...
You're not sacrificing quality.
Will healthcare reform here in the U.S. help or hinder medical tourism?
Well, Deloitte estimates that it's going to help medical tourism, and we tend to agree. What we're finding is that patients are becoming extremely educated about healthcare options. They're making choices based on value, and that value is a combination of quality and affordability. And so through healthcare reform, we're going to see that insurance becomes more competitive, and while we may decrease the number of uninsured patients, I think we're going to end up with a lot of underinsured patients, where the cost of surgical procedures is still going to be so high that the deductibles that need to be paid, or just the limitation on the amount the insurance company will pay towards a procedure, is still going to be there.
Renee-Marie Stephano, president of the Medical Tourism Association, joining us from Los Angeles. They're having that global health conference in LA on Monday. Renee, thanks.